Tonight we take a closer look at the recent developments in Jamaica's healthcare system, particularly at the Cornwall Regional Hospital and the Savannah Lamar Hospital, where a group of healthcare workers engaged in what we consider a silent demonstration for a second consecutive day. Their action, of course, which includes medical technologists, support staff, aimed at drawing attention to a series of long-standing employment-related matters. At the same time, there are growing reports from newly trained registered nurses who say they're finding it a bit difficult to gain employment in the public health system, despite acknowledged staffing needs in some areas. To help us understand the broader context and the ministry's response, we're joined by the Minister of Health, Dr. Christopher Tuftton, actually Minister of Health and Wellness. And this evening, you will have him on Lead Story. Lead Story starts now. Hello and welcome to Lead Story. I'm Sondre Roden. Joining us now is Minister of Health and Wellness himself, Dr. Christopher Tuftton. Welcome, Dr. Tuftton.
Thank you very much for having me.
Let's get right into it, Dr. Tuftton. Their concerns, their questions. People are wondering, people are asking, particularly in the western end of the island, about the medical technologies, the support staff. They're saying, no gears, no PPE. We've been waiting for a while. Some of us started the work here, so we'll soon get it, and we haven't received it just yet. What has the Ministry of Health, and from your vantage point, what is being done about the situation?
Okay, so I suspect you're referring to the protests or the sick-out.
The sick-out, yeah. I'd call it a protest sick-out, but it's not a demonstration.
So I want to clarify, because just for fear that there's a misunderstanding. The medical system does have PPEs and gears. The issue is outstanding arrears that have been negotiated under the compensation review arrangements, which started some years back, and the commitment that would have been made to pay certain amounts, including uniform allowance and so on. Mm-hmm. And those arrears were committed to at a particular point, and the dates have been pushed back. The ministry is involved to some extent, but it's really a negotiated position with the Ministry of Finance.
Finance, yeah.
Of course, it's collective responsibility, so we're not blaming the Ministry of Finance alone. It's a conversation. We did receive the resources to pay, about just over $3 billion. Unfortunately, we received those resources late in the June cycle, when the salary packages was already processed or being processed.
You mean June 2025?
June, yeah, this month. And there was an expectation that those sums would also be paid with that. Mm-hmm. We had written through the permanent secretary and the respective regions to indicate to the different groups that they would not be able to get in June, but the monies are there, they'll get it in July. Mm-hmm. How the system works apparently is that if you once you run a salary run for 1 month, you can't run it twice. Mm-hmm. So because they missed that cycle, because of the funds coming from the Ministry of Finance later than we had anticipated, they would have to get it in July. So the protest action, as I understand it, is because of those outstanding sums. There is one institution which may have been paid this month, and that is the Bellevue Hospital. The Bellevue Hospital is not paid by the Ministry of Health. It's paid directly from the Ministry of Finance. So sort of outlier arrangement. So I suspect, and this is what I'm trying to understand, that what transpired is that the rest of the system were told to wait until next month. One institution was paid this month. And that's because of how the arrangements are made. And it created this kind of disaffection, if you want to call it.
Yeah,
So we have tried to appeal to the different groups and hope that good sense will prevail. I mean, it's hard to abandon life-saving systems, and traditionally our health workers don't do that for too long. They make a statement and they resume, and we try to address the situation. The situation will be addressed. I want to reassure them.
Before you get into that, Minister, we're going to go for a break,
Sure.
and we're going to return with our Minister of Health and Wellness, and we're going to get into some more conversation because we know you have questions to ask, and we ask them right here on Lead Story. We'll be right back.
Equipment, the new name in forklift sales and rentals in Jamaica. Top quality, low prices, fleet discounts available, 12-month warranty, free service parts, daily rentals, crazy cheap. Ashman's Equipment, same forklift, better deals.
Let's delve deep into the issues. We'll take you beneath the surface.
Greetings and salutations. My name is Orville Higgins, and it's another edition of Fan Central.
Talking to the people at the heart of the top sporting stories. Hear from your favorite sportsmen and women and the administrators who work tirelessly to make it all happen. It's live sports talk.
I've written an entire article.
Yes.
Looking at all the major issues every Tuesday at 9 p.m. It's Fan Central.
Rise with sunrise, Mighty takes July by storm. We begin with some sweet gospel melodies in Wednesday service. John Mark Wigan joins us live. Then it's over to the kitchen for a sweet mix. We're taking a break with some summer mocktails. We'll pair your mocktail with a good read in Sunrise Book Club. And your Wednesday fun wraps up in Wags, brought to you by TruePet. Why Not Wednesday is powered by Flow. You've never seen a sunrise quite like this.
We're back on Lead Story. We've been having a conversation with our Minister of Health and Wellness. As we continue in this conversation, we've been talking about the, what we term a sick-out kind of a demonstration from some of the medical technologists, support staff in the Corner Regional Hospital, Savannah Lamar Hospital, etc., the Western region. The concerns that would have seen a letter from St. Patrice Ennis speaking a lot about the issues dating back as far as 2023. Our Minister of Health would have said that the funds were then given to the ministry, but there was some delay as it relates to the handing over from the Ministry of Finance to the Ministry of Health. So, Minister, the question to you then is the expectation after conversation with the union, with the medical technologists, etc., is the expectation then that they will be back to work after being guaranteed that next month they should get that payment that they're awaiting?
So they will have to make that decision. I do hope so. What I know is that the disruptions that were created yesterday and today around payments was a result of the expectation that the payments would be in June. I can guarantee that the payments would be in July because we are in receipt of the monies.
So, Minister, if they don't get it in July, Minister?
No, the monies are. I have a memo here on my phone from the Chief Financial Officer saying this is what they have, and the cycle is what created the mess up because of the late delivery. So I do expect that July will see those payments. So I would certainly urge them. I mean, I understand, we understand that these things, there are frustrations. People make their plans and so on. We have had some issues in the past number of months because of late payment, which are routine payments, which we try to address through several meetings with the Ministry of Finance. This is not a similar case. These are arrears linked back to the new compensation review process. So it's a different process.
Okay. So, taking you to a different hospital, Minister, we're going to come all the way from the west back into Kingston Victoria Jubilee Hospital, 24 dead babies. We heard the uproar. I think you were on this program last week, but Lead Story Prime, speaking at length about it. But the question that continues to permeate the space is, what next? What is happening? People are still asking, what should we expect as it relates to neonatal care? And how do we prevent it from happening, or should we just, expect another case like this? Because it seems as though, when I spoke to the CMO last week, that she's saying there are some issues as it relates to premature babies.
Right. So there's a very different situation in this instance, as I understand it, based on the reports I've seen, the technical reports, as opposed to in previous circumstances where there would have been an infection outbreak within the hospital. This is not the case, as I understand it now. This is a case of an unusually high incidence of premature births over the period of time. And those premature births mean vulnerable babies. Because let's face it, premature means less organ development. And that could be amplified too by the babies being sick when they are born. And that's a function of a range of things in terms of the underlying condition of the parents, the expectant mothers. Are they hypertensive? Are they diabetic? Do they smoke or drink? A number of issues. Part of it is late presentation. How long before you appear at the doctor?
At the hospital.
Right. So, for example, the data that I have is that while we have been improving from 22% in 2018 to 45% in 2024 for mothers to appear to a health center within the first trimester, that's the first 13 weeks, the very early stages of the baby developing inside the womb, only 44% of mothers actually turn up in that first trimester. And we do have cases where they turn up even later, right? Much later. That's not to blame the mothers, because I think we all have a responsibility. The system has to do more outreach, and we have to make it easier and also educate and inform and persuade persons who are pregnant to conform to a certain lifestyle and follow the regime of visitation.
Yes.
We have seen improvements in that too, which is good, and we have seen mortality rates come down. In fact, post-COVID years, we were on too high, 200 plus. Last year, we were 133 per 100,000 births. So we're actually going in the right direction, and that trend continues despite the outlier situation that we have had at Victoria Jubilee Hospital.
So the question, Minister, some mothers or some viewers are saying that some people feel like the mothers are being blamed. That's one. And the second thing being asked now is an investigation being done to understand why we're having this greater incidence of premature births?
I've never blamed anyone, actually. I think it's important to appreciate that there is a very holistic approach to how to deal with these issues. The mothers certainly have a very important role to play, and I think to avoid saying that would be to be unfair to how the system and how the process should work. I mean, you are carrying a young one inside you, and there are certain protocols that go with that for the best results. But having said that, the system must give you support.
Right.
And the system is very, very important. The doctors, the nurses, the health centers, and of course the hospital who deliver and care for the child. It is that combination that determines the risk profile of a healthy birth and by extension a healthy child. So you can't address one without addressing the other. Now, so I think we have to address it in a holistic way, which is why I say all of us have a role to play. The second part of the question about how we are improving.
Yeah.
We're improving through a lot more training. We've done a lot more training over the last couple of years, particularly in the post-COVID years because of the trends. We've added more equipment. We have upgraded a number of health centers because a big part of the outreach is in the community. Because really where it starts, maternal care, is the health center visits before you get to the hospital to deliver. So we have upgraded 338 health centers, $4 billion over the last 5 years. All of them have a maternal segment, an area that deals with that. So, and we have added more doctors and nurses. So I think from that standpoint, the system is improving. In fact, it's improving, and the numbers show the improvement. The numbers show the improvement in terms of maternal mortality, which was 200 plus during the COVID years to now 133.
All right, hold
and
it there
actually going in the right
hold
direction.
it there for me, Minister. We're going to take a break, and when we come back, we'll have more as we continue to look at these issues we have in our healthcare sector.
Legal and Constitutional Affairs is
6:45. Millions of people are attacked by harmful mouth bacteria. The root cause of bad breath, gum problems, cavities, plaque, and tartar. That's why Colgate combined the best science and technology in Colgate Total. Unlike others, its superior formula fights bacteria and creates a powerful protective barrier for up to 24 hours to prevent them from coming back. Take control of your oral health with Colgate Total.
We're back, and of course, we're with the Minister of Health and Wellness. We've been talking about issues in the healthcare sector as a whole. We spoke about the Western Regional Health Authority. We spoke about the Victoria Jubilee Hospital, the babies there, and the minister would have given us. He's started to go into this aspect of building out the public health system, particularly in those communities with the health centers that are being built. And Minister, as we continue on that point, there has been a notion that, you know, a lot has not been happening because Cornwall Regional Hospital is not yet done. People have been waiting. But what we've been seeing is a lot from the governance side, from the government side, a lot of ribbon cuttings for a lot of these health centers. So could you, for me, in the next 5 minutes that we have, do that juxtaposition, you know, persons questioning timeline for Cornwall Regional and then see.
Well, I don't think people should buy into this rhetoric about ribbon cutting being a bad thing. Ribbon cutting means an opening. It means a renewal. It means, and by extension, could mean many things. The 138 health centers have benefited significantly from improved services, both doctors, nurses, and infrastructure. Cutting the ribbon to them is a good thing for the community. And we shouldn't ever feel otherwise, because the people who go to those facilities enjoy the fact that they have air conditioning, clean bathrooms, new waiting areas, more doctors, more nurses.
Well, how much health centers have you opened in the last 9 years?
Over the last 9 years, it will be closer to, well, the last 5 is when I have data for it. It's 138, $4 billion. Renovation and some new.
Okay.
We're building some very large ones now in Old Harbour, St. Jago Park to renewal, Portmore. We just did a contract signing and groundbreaking in Ocho Rios and in the Discovery Bay or Runaway Bay, Brownstown. And we're doing one on Friday at the Maypen Hospital ground. This is a brand new health outpatient facility. So,
but on that point, Minister, noting that you're opening all these health centers, we received, well, at least I saw a letter that was sent by some nurses, young nurses, registered nurses, saying they're not finding ease, and this is my final minute I'm being told by the producer, they're not finding it as easy to get access to jobs in the public healthcare system.
So it depends, because we have shortages that are specific to particular disciplines, largely because of people having the option to migrate, and they do. So there are about 8 categories of specialization where we have shortages. But we also have shortages in some of the regular generalist positions, but it depends on where they are located. So I'll give you an example. So you have shortages of doctors in Portland, and you'd love to fill those spots, and these are generalists, but a lot of people are not willing to go to Portland to live. So sometimes it's a matter of where people choose to work or would like to work. Another time is a function of the specialization that is required. So it's not as simplistic as saying there are nurses out there who want job and can't get job. It really depends. So you would have to interrogate that particular nurse or group of nurses, and then you determine where that fit is.
All right, Minister, thank you so much. Minister of Health and Wellness, you'd have talked to us about a plethora of issues, Western Regional Health Authority, Victoria Jubilee Hospital, nurses, and some of those health centers that would have been opened over the last 5 years. We're going for a break. We'll be right back with you. It's Lead Story.
To breaking news, Lead Story Prime dives deeper, cuts through the noise, and uncovers the stories that shape your world. Join us every Tuesday at 8 p.m. for Lead Story Prime with me, George Davis, for an hour of incisive analysis, expert interviews, and unparalleled coverage of the issues you care about. Lead Story Prime, your front row seat to the most compelling discussions. Lead Story Prime, where the truth comes first. Only on CVM TV.
The internationally acclaimed On Stage with Winfred Williams.
At a new time, Saturdays at 8 p.m. on CVM TV.
So much more than entertainment.
Welcome back. We are now joined by Opposition Spokesperson on Health and Wellness, Dr. Dawes, for his perspective on the unrest rippling through segments of the healthcare sector, particularly in the Western Regional Health Authority. Now, I had the Minister of Health earlier. He spoke to us about Western Regional Health Authority, Victoria Jubilee Health Centers. He didn't really get to touch on the Cornwall Regional based on the time we have. But Dr. Dawes, I want to start with you this evening. Welcome, Dr. Dawes. You hearing me clearly?
Hi, good evening, and good evening to all the viewers.
Welcome back, Dr. Dawes. I know we had you some time ago, very recently, but I want to switch focus a little bit, Dr. Dawes, to what's happening in the Western Regional Health Authority. The medical technologists, the support staff over there, Savlamar Hospital, Cornwall Regional Hospital, they have a kind of staged what I'd say a silent protest, because it's not placards, but it's more of a sick out, not turning up, based on some issues they'd have had that would have dated as far back as 2023, some payments, some equipment, etc., clothing, allowance, etc. Give me your comment and your reaction on that.
It's beyond just the Western region. Spanish Town Hospital, the lab tech and X-ray technicians, they're having issues as well. Even the ambulance drivers, I'm not sure if the minister is aware that there has been a cap now on how many hours overtime people will be paid. And because of that, you're left with lack of coverage, and nobody is going to want to work extra hours and not be compensated. So what's happening is that you will have ambulances parked up, and patients will have to find money for private ambulances to get them out of Spanish hospitals. You have plans for early closure of vital diagnostic centers in terms of the X-ray units, radiology units, and the labs at that hospital. This morning, you had a protest action by the outpatient nurses at the Bustamante Hospital for Children. So this is a widespread issue, and all of it is related to compensation, and it's dating back as far as 2023, as I said. But then there are new measures implemented now in a bid to cut the overtime, which you cannot cut overtime in isolation because of the severe staff shortages across the different disciplines and allied healthcare workers needing to do overtime to fill the gaps to support clinical medicine. If you cut overtime without the staff supply, you're going to disrupt services, and that's what's happening right now.
So, Dr. Dawes,
when we said that,
on that point, though, I was having a conversation earlier today, and the issue of hospital management versus ministry involvement versus Ministry of Finance. Where exactly does the buck stop when it comes on to the role of the Ministry of Finance and Public Service in these issues of time management, the role of hospital management, and then the role of the Ministry of Health?
So ultimately, it rests with Cabinet because all of these are policy decisions. When they signed off on the wage negotiations, I don't think they understood the necessity of overtime. So in negotiations, they would have rolled everything into basic salary and thought that that was it. But hospitals run on overtime. And now for you to tell workers that they can't get overtime, but they're expected to continue to perform as if it's business as usual. I don't know who was on the negotiating side from the Ministry of Health, but I don't know if it's that they didn't understand or they were trying to bully the staff into accepting the deals. But that is what you're left with right now. So they have to accept responsibility. And you can't ask staff to sacrifice their pay when they're working in substandard conditions, when they don't have the tools to effectively perform their jobs. When they hear about all of this money being spent and at the end of the day, there's no improvement in service. I mean, just one example, there has been a boast about how much money has been